Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having some issues managing my blood pressure, and my ankles have started swelling. It's been a few months now since January, and I'm not sure if it's getting worse or not. I've been prescribed nifedipine, but I haven't seen much improvement. Also, I haven't been taking the lisinopril because I was confused about its addition to my regimen.
I see. It's important we manage your blood pressure closely. Swelling in the ankles can be a side effect of some blood pressure medications like nifedipine. Let's discuss the lisinopril, which is also for blood pressure. It's crucial to maintain consistency with your medications to manage your condition effectively.
That makes sense. Also, I've been dealing with this back and shoulder pain. I've tried various NSAIDs but found celecoxib to be the most effective. I stopped because it's expensive and I was waiting for VA approval. Can we look into getting that sorted out? The pain does get pretty bad, especially after my golf sessions or when I'm in my woodworking shop.
Absolutely. We can definitely explore getting celecoxib approved for you. Effective pain management is key to maintaining your quality of life, especially with your active lifestyle. Speaking of which, how have your daily activities been affected by these issues?
Well, I try to stay active with walking and hobbies, but sometimes the pain and the swelling make it tough. I elevate my legs when the swelling gets bad, and that helps a bit. But I've been going to the chiropractor more often for my back, hoping it might provide some relief.
That's good to hear that you're taking steps to manage your symptoms. Elevating your legs is a good strategy. Keeping active is also beneficial, but we need to ensure you're not overexerting yourself, which could exacerbate your pain.
I've also been concerned about my rosacea. I have an appointment with dermatology coming up. The doxycycline seems to be keeping things under control for now.
That's good to keep it under control with doxycycline. Keeping in touch with dermatology will be beneficial. Now let's review some of your recent lab results to ensure there aren't other underlying issues affecting your health. Your blood pressure today is 130/80 mmHg, which is a good sign that the medication adjustments might be starting to work, but we'll keep an eye on that.
That's a relief to hear. I've been worried about the readings I sometimes get at home. They fluctuate quite a bit.
Home blood pressure monitoring can vary, and it's useful for tracking trends rather than individual readings. Now, looking at your labs, your kidney and liver functions are stable, which is excellent. Your cholesterol levels are within target ranges, but we'll continue to monitor these as part of your overall cardiovascular health management.
I've been trying to eat better and keep up with the walking to help with that too.
That's fantastic. Dietary changes and exercise can have a significant impact on your overall health.
What about the follow-up? When do you need to see me next?
We have you scheduled for a follow-up on June 19th. We'll recheck your blood pressure and conduct comprehensive lab tests to check on your kidney and liver functions and overall health status. We'll also coordinate with dermatology regarding your rosacea.
Thank you, doctor. It's reassuring to have a clear plan moving forward.
You're welcome. It's important to stay proactive about your health. Please don't hesitate to call if your symptoms change or if you have any concerns before your next appointment. Take care and see you in June.
Will do. Thanks again for all your help today.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I came in because my chest pain has been persisting, and now I'm getting this numbness in my left arm more often, especially when I sit down. It's really uncomfortable and starting to worry me. I've also had some dental pain recently when I eat or drink. I think I might need a referral for that, and also a follow-up at the liver clinic.
Can you describe the chest pain for me? Is it sharp or more like a pressure? And when does it typically happen?
It's like a heavy pressure most of the time, right in the middle of my chest. It doesn't really happen at a specific time. It can be when I'm resting or when I'm walking around. The arm numbness usually follows the pain. As for the dental pain, it's sharp and sudden. I noticed it the past couple of weeks.
Have you noticed anything that makes the chest pain better or worse? Any changes in your symptoms since we last met?
Not much has changed about the chest pain, but it hasn't gotten better with the usual rest and medications. Smoking probably doesn't help, but it's been hard to quit, even though I know I should, especially with the liver fibrosis.
It's good that you're aware of the impact smoking has, especially with your history of liver issues. Let's also talk about your arm. Was there any specific injury or surgery in the past that might relate to the numbness?
Yeah, I had surgery on my left arm back in 2006 after a work accident. It was pretty bad back then, but it healed up okay, or so I thought. Maybe it's acting up again?
It's possible. Previous injuries can sometimes cause problems later on. And how about your general health otherwise? Any weight changes, appetite, or energy levels?
I've been maintaining my weight, more or less, but my energy levels aren't great. I get tired easily. Also, dealing with the hepatitis has been tough. I'm not even sure about my current hepatitis C status.
I see. We've ordered some urgent lab work to check on your liver function and hepatitis status, so we should have more information on that soon. Given your symptoms and history, it's important we stay on top of these conditions.
I understand. It's just a lot to manage, with the liver, the prostate, and now these chest pains and numbness.
Absolutely, it sounds overwhelming, but you're doing the right thing by addressing these issues head-on. Now, concerning your dental pain, we'll definitely get you a referral to address that. Managing pain from multiple sources can complicate how you feel overall.
Thanks, doctor. I appreciate it. It's just hard keeping track of everything. My medications, appointments. It feels never-ending.
I can imagine. We'll try to coordinate your care as much as possible. Speaking of medications, you're currently on hydrochlorothiazide, finasteride, metoprolol, potassium chloride, aspirin, amlodipine, and terazosin. We discussed increasing the amlodipine due to your elevated blood pressure today. How have you been feeling on your current medication regimen?
The medications are fine, I guess. I haven't noticed any new side effects, but my blood pressure still seems to be a problem despite taking them.
We'll address that with the adjustment in amlodipine. High blood pressure can contribute to your symptoms, so it's important we manage it effectively. Let's also make sure you pick up those adjustments at the pharmacy after this.
Will do. What about the follow-ups?
You'll need to attend the liver clinic soon. The appointment details will be in your discharge summary. Also, ensure you get the lab tests done today. We need those results to make informed decisions about your liver and overall health. The dental clinic appointment will be scheduled for you, and you should receive a notification soon.
Okay, that sounds like a plan. I just hope we can get to the bottom of this chest pain and numbness soon.
We'll do everything we can. It's also crucial that you try to quit smoking. It has significant impacts on not just your liver, but your overall health, especially your lungs and heart.
I know, I've been trying. It's just really hard.
I understand, and we're here to support you in that journey as well. We'll review everything again when you come back for your follow-up in 6 months or sooner if you have any issues before then.
Thanks for all your help, Doctor. It really means a lot.
You're welcome. It's important to us that you feel supported and informed about your health. We'll see you back here soon, and don't hesitate to reach out if you need anything in the meantime.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Based on what you've shared and our observations today, it looks like Ella is progressing well with her motor skills, which is great news.
Yes, she's been quite active, but I'm a bit worried about her speech development. She's not saying as many words as her older brother did at this age.
It's good that you brought this up. Children do develop at their own pace, but it's important to monitor their progress. For speech, Ella should be able to use simple words and start combining them. We can encourage this by reading to her regularly and engaging in conversations with her throughout the day.
We do read to her, but I'll definitely try to include more conversation. Should we consider seeing a speech therapist?
Let's give it a little time. I'd suggest we monitor her over the next 3 months and check her progress during her next visit. If there's little improvement, we can discuss a referral to a speech therapist then.
Now look at question 26.
Good morning, everyone. Today I want to discuss strategies for effective community health outreach, a critical component of public health. First, it's essential to identify the specific needs of the community through surveys and direct feedback. This allows us to tailor our programs effectively. Next, partnering with local organizations can extend our reach and impact. These partnerships can provide valuable resources and local insights that are crucial for the success of our programs. Lastly, we must ensure ongoing evaluation of our outreach efforts. This means collecting data on outcomes and adjusting our strategies as needed to improve health services. Effective communication, continuous engagement, and adaptable strategies are key to managing successful community health outreach.
Now look at question 27.
Doctor, I've been monitoring Mr. Lawson's response to the new medication, and I've noticed some concerning side effects that aren't improving.
What specific symptoms are you observing?
He's been increasingly lethargic and nauseous. I'm worried it's impacting his overall recovery, and he's also expressed a lot of discomfort.
Thank you for bringing this to my attention. Do you think adjusting the dosage or switching medications might help?
I believe a medication review could be beneficial. Perhaps a lower dose or a different medication with a similar therapeutic effect but fewer side effects could improve his quality of life during recovery.
I agree. Let's schedule a review of his medications and consider alternatives. Your observations are invaluable in tailoring his care effectively. I'll make the necessary arrangements.
Now look at question 28.
Today we're going to explore the critical topic of organ donation, a decision that can save numerous lives. First, let's discuss the types of organ donation: living donation and deceased donation. Both play a vital role in transplantation. Living donors can donate a kidney, part of the liver, lung, intestine, or pancreas. This type of donation requires careful medical and psychological evaluation to ensure the safety and well-being of the donor. Deceased donation, on the other hand, occurs after a donor has passed away, with organs potentially saving up to 8 lives. It's important for individuals to register as organ donors and discuss their wishes with family members. I encourage everyone to consider these options not only as a way to help others, but as a powerful legacy. For more information, you can visit national and local organ donation registries.
Now look at question 29.
Let's go over some exercises that will help with your recovery. First, we'll start with gentle stretching exercises to improve flexibility and decrease stiffness.
Should I be worried about any pain while doing these exercises?
It's normal to experience some discomfort, but you should stop if you feel sharp or intense pain. The goal is to enhance your mobility without overstraining the surgical site.
We'll also include some strength-building exercises. These will be low intensity at first, focusing on supporting muscles around your surgery area. Gradually, we'll increase the intensity as you improve.
How often should I do these exercises?
I recommend doing them twice a day. Consistency is key to your recovery, and always listen to your body. If something doesn't feel right, pause and let me know during our sessions.
Now look at question 30.
Welcome everyone to our presentation on the Eat Right, Live Bright initiative, aimed at promoting healthy eating habits among our community members. Today, we'll discuss practical ways to incorporate balanced nutrition into your daily life. First, let's talk about understanding food labels. Knowing how to read and interpret nutritional information is crucial for making healthier choices. We're also launching a series of workshops on meal planning and budget-friendly shopping tips to help you manage your dietary needs without overspending. Finally, we'll introduce community cooking classes that will teach you how to prepare healthy meals that are not only nutritious, but also delicious. We believe that healthy eating should be enjoyable and accessible to everyone. Please join us in this initiative. Together, we can make a significant impact on our health and well-being.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone. Today, we delve into a complex and critical issue affecting public health, vaping-associated pulmonary illness, or VAPI. This condition has surged into public consciousness over the past few years, coinciding with the rise in popularity of e-cigarettes. We'll discuss the evolution of this health crisis, its impact, and the role of healthcare providers in addressing this epidemic. Let's begin with a case study that underscores the gravity and complexity of vaping. Consider the case of a 19-year-old male, referred to here as Patient X, who was admitted to the emergency department with severe respiratory distress. Patient X was previously healthy, with no significant medical history other than occasional recreational vaping. Over the week prior to admission, he developed a progressive cough, fever, and shortness of breath. Upon admission, his oxygen saturation was noted to be 88% on room air, and imaging revealed bilateral pulmonary infiltrates, classic signs of acute respiratory distress syndrome, DS. Patient X was admitted to the intensive care unit, ICU, and required mechanical ventilation due to the severity of his symptoms. This case highlights not only the severe impact of vaping, but also the rapid progression from initial symptoms to acute, life-threatening illness. Vaping-associated pulmonary illness first came into the spotlight in mid-2019, with clusters of cases presenting symptoms similar to chemical pneumonitis. Research published in the New England Journal of Medicine outlined a series of 53 cases, which provided the first formal acknowledgement of the link between severe pulmonary disease and vaping. These cases had a median age of 19 years old, emphasizing the prevalence of vaping among young adults. Further investigation revealed that the lung injuries were likely associated with the inhalation of vitamin E acetate, an additive in some THC-containing e-liquids. This discovery was significant because it pointed to the dangers of unregulated substances in vape products. The Harvard T.H. Chan School of Public Health conducted studies showing that the heating of vitamin E acetate might release toxic ketene gases, known to cause lung injury. The response from the healthcare community has been multifaceted. Clinicians and public health officials have worked to increase awareness of vaping, implement better diagnostic criteria, and enhance reporting mechanisms for new cases. For instance, healthcare providers are now more vigilant in screening for vaping use during clinical evaluations, particularly in patients presenting with unexplained respiratory symptoms. From a treatment perspective, management of VAI typically involves supportive care, including oxygen therapy, steroid administration to reduce lung inflammation, and, in severe cases, mechanical ventilation. Patient X's treatment was in line with these guidelines. His condition gradually improved with intensive care and a multidisciplinary approach involving pulmonologists, toxicologists, and critical care specialists. However, the vape crisis also highlights a broader issue, the need for regulation and surveillance in the vaping industry. The U.S. Food and Drug Administration, FDA, and Centers for Disease Control and Prevention, CDC, have intensified efforts to regulate vape products, focusing on banning flavored e-cigarettes that are particularly attractive to younger demographics. Public health campaigns have also been pivotal in educating the public about the risks of vaping. These campaigns stress the importance of avoiding substances not approved by health authorities, especially from informal sources such as online vendors or friends. The rise in vaping cases has indeed led to a significant decrease in the popularity of vaping among teens, a trend reported by the CDC in their annual youth tobacco survey. While we have made substantial progress in understanding and managing vaping, the condition remains a significant public health challenge. Ongoing research is crucial to fully elucidate the mechanisms of lung injury associated with vaping and to develop targeted interventions. The healthcare community must continue to advocate for stringent regulatory measures and educate patients about the potential risks of vaping. Thank you for your attention today. Let's continue to work together to tackle this evolving health crisis and protect our communities from the dangers of vaping-associated pulmonary illness.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good evening, everyone, and thank you for joining us for today's in-depth webinar on the advanced management and therapeutic approaches in osteoporosis, focusing on postmenopausal women. Today, I will discuss the complex landscape of osteoporosis treatment, highlighting emerging therapies and the implications of recent clinical trials. Let's dive into a relevant case study to better understand these concepts. We recently had a patient, Mrs. Thompson, a 72-year-old Caucasian woman with a history suggestive of osteopenia. She experienced a minor fall resulting in a wrist fracture. Mrs. Thompson's medical history is notable for early menopause at age 47 and a family history of osteoporosis. Her lifestyle factors include limited physical activity and a diet low in calcium. She's a non-smoker and uses alcohol minimally. Given these factors, Mrs. Thompson was at a significant risk for osteoporosis. Initial assessments included a dual-energy X-ray absorptiometry DEXA scan, which indicated a T-score of -2.5 at the lumbar spine and -2.0 at the hip, categorizing her into osteoporosis. This diagnosis prompted a discussion about therapeutic options, emphasizing the need for a strategy that addresses both the prevention of bone loss and the promotion of bone health. The primary approach to managing osteoporosis involves bisphosphonates, which have been the cornerstone of treatment due to their effectiveness in reducing the risk of fracture in postmenopausal women. According to a study published in the Journal of Clinical Endocrinology and Metabolism, bisphosphonates, such as alendronate, can decrease the incidence of vertebral and hip fractures by about 50%. However, recent advancements have introduced new classes of drugs that offer potential benefits over traditional therapies. One such drug is romosozumab, a monoclonal antibody that inhibits sclerostin, a protein involved in bone formation regulation. The pivotal ARCH, active controlled fracture study in postmenopausal women with osteoporosis at high risk trial, which was published in the New England Journal of Medicine, demonstrated that treatment with romosozumab resulted in a significantly lower risk of vertebral fractures compared to alendronate over a period of 24 months. Romosozumab's mechanism involves both increasing bone formation and decreasing bone resorption, which is ideal for patients like Mrs. Thompson, who not only need to prevent further bone loss, but also potentially regain bone density. However, it's crucial to consider cardiovascular risk when prescribing romosozumab, as the ARCH trial also highlighted a slight increase in serious cardiovascular events with its use. This necessitates a thorough cardiovascular assessment before initiating treatment. Furthermore, in discussing treatment plans with patients, it's essential to address the potential side effects of long-term use of osteoporosis medications, such as atypical femoral fractures and osteonecrosis of the jaw, though these are relatively rare. Patient education and regular monitoring can effectively mitigate these risks. In addition to pharmacological treatments, we must not overlook the importance of lifestyle modifications in managing osteoporosis. This includes dietary recommendations to ensure adequate intake of calcium and vitamin D, alongside promoting regular weight-bearing and muscle-strengthening exercises, which have been proven to improve bone density and reduce the risk of falls. Mrs. Thompson's treatment plan included starting on romosozumab for a year, followed by reassessment to possibly transition to a bisphosphonate, depending on her response and side effect profile. This case highlights the importance of a tailored treatment approach based on individual risk factors, recent research, and ongoing monitoring and reassessment. Thank you for your attention. I hope this discussion provides you with a clearer understanding of the complexities and depth of managing osteoporosis in postmenopausal women. I look forward to your questions and further discussion on this crucial topic.